The chemoexfoliation is a medical procedure that consists of the application of organic acids on the skin in order to treat various cutaneous conditions or pathologies. Chemoexfoliation carried out with normal solutions of organic acids, however, is characterized by an important limiting effect. The trauma induced is not proportional to the ability to renew the epidermis or to remodel the dermis. The EnerPeel technology, thanks to the control of electrochemical prerogatives of organic acids, is able to ensure a more efficient chemoexfoliation with reduced surface trauma. Although EnerPeel technology allows to reduce the trauma intensity, it is important to manage the variables that we know can increase the risk of complications. Before performing a chemoexfoliation procedure, the general exclusion criteria should always be taken into consideration. They describe when it is not advisable to perform the procedure, and they are listed in the instruction manual included in the packaging of medical devices EnerPeel. Complications can be divided into immediate and delayed. The immediate complications appear during or at the end of the chemoexfoliation procedure, and they are mainly represented by 1. Itching, burning, stinging, in general correlated with the use of glycolic acid, pyruvic acid, or trichloroacetic acid. 2. Erythema and edema, detectable with the use of trichloroacetic acid or glycolic acid at concentrations higher than 50%. 3. Unexpected epidermolysis during the use of glycolic acid or pyruvic acid at concentrations higher than 50%. The main delayed complications are represented by 1. Loss of barrier function of the skin, lesions that can lead to bacterial, viral, or candidal infections. 2. Formation of the so-called demarcation lines, changes in texture, disorders in wound healing. 3. Hypo or hyperpigmentation of post-inflammatory origin. Generally, these delayed complications are the consequence of a medium-deep chemoexfoliation, usually obtained with acids such as trichloroacetic acid. The main variables that may increase the risk of complications depend on 1. The general characteristics of the patient. 2. The nature of the used acid. 3. The followed procedures to do the chemoexfoliation. The general characteristics of the patient primarily include the clinical history, the known or foreseeable allergic response, or any other kind of incompatibility related to the individual components of the formula. The evaluation of the patient's skin, thickness, degree of keratinization, skin dryness, and of the possible presence of micro-lesions is also important. The risk of complications, considering the GLOGO scale, is smaller in the degree of aging 2 and 3, slightly higher for GLOGO 1, and it increases with GLOGO 4. It is in any case recommended to assess the risk of complications, erythema or pigmentation disorders correlating the genetic racial characteristics and photoaging. In this regard, considering the subdivision of genetic racial characteristics according to the analysis of Nabil Fanous, we can identify the following main sets: Nordics, Europeans, Mediterranean, North Africans and Africans, Indo-Pakistani, North Asians, South Asians. The racial characteristics and the correlation with the degree of photoaging, and therefore the level of keratinization of the skin, are important to predict the outcome of the treatment and for the planning of how deep and aggressive the treatment should be. Nordics. The most frequent complication is represented in erythema. In the Nordics, the risk of complications is in relation with the degree of photoaging, since in the highest values of the GLOGO scale, skin thickness decreases and simultaneously increases the risk of erythema and sometimes of telangiectasia. Europeans. Normally, Europeans are excellent candidates for chemoexfoliation. The risk of intense or permanent erythema and pigmentation disorders is reduced when compared to other groups. The recovery time is shorter. Mediterraneans. The Mediterraneans are usually good candidates for chemoexfoliation. The most common complications are related to the formation of hyperpigmentations, usually related to sun exposure. In the Mediterraneans, the achievement of a uniform color takes longer compared to the Europeans. The risk of erythema is reduced. Indo-Pakistani. The risk of complications such as hyperpigmentation and erythema, which can turn into hyperpigmentation, are at a higher risk level than for the Mediterraneans. In the case of strong acids and greater depth of chemo exfoliation, it is necessary to consider the risk of hypopigmentation. Africans. The increased risk of complications is related to the possibility of generating hypopigmentation that may be permanent. As the intensity of the color of the skin moves towards more pronounced tones, Central and Southern Africa, the risk of deep pigmentation alterations increases. In general, the Africans are excellent candidates for superficial peels, while the deep ones are not recommended. Asians. Complications in North Asians, characterized by a clear complexion of the skin, are mainly represented by erythema and hyperpigmentation. For some aspects, they may be compared to complications detectable in Mediterraneans. South Asians have an increased risk of hyperpigmentation, and their response to complications is comparable to those typical of Indo-Pakistani. In summary, considering the genetic racial characteristics, the best candidates for chemo exfoliation are Europeans, followed by the Nordic countries, the Mediterraneans, Indo-Pakistani, and Asians. Equally important are the variables related to the technique of application of the acid to determine the increased risk of complications. These variables are represented by 1. High amounts of applied acid and/or prolonged contact time of the acid with the skin before neutralization or removal of precipitates. 2. Closely following up procedures increase definitely the risk of complications. 3. Pre-treatment with alpha-hydroxy acids or retinoids may, on one hand, allow to obtain important clinical benefits. It may, on the other hand, also increase the risk of complications. EnerPeel chemo exfoliation is effective and safe. When planned and carried out properly, it can lead to great success in various skin conditions or pathologies, such as chrono and photoaging, skin hyperpigmentations, actinic keratosis, acne, seborrhea, rosacea, scars, including the post-acneic ones. EnerPeel, the future in chemo exfoliation.